Hello, this is Deepal Parikh from At Home with Wellness. We had a little bit of a glitch a few minutes back going live at 1. It just kept getting disconnected. But yes, I think I'm on here. So once again, take two. Every time it's a take two. This is Deepal Parikh from At Home with Wellness. So excited to present today's topic here, which is about cholesterol myths and the facts, right? So here we are. This is our second week of IG Live. Next week will be the third and the final week. So just stay tuned on to just find out the myths and the facts here. So cholesterol, what is it, right? It's basically a fat-like organic molecules that are transported and needed in our bodies. Now, since it's a fat, it's not going to be mixing with the blood, which is water-based. So what happens is cholesterol is packaged in these lipoproteins and then transported to different parts of our bodies. Now, cholesterol, you just talk about cholesterol and there is a sense of negative energy that you sense around people, right? It has been demonized just like saturated fats. But cholesterol is absolutely essential for life in countless ways. So many people around us, they have been put on medications to lower this really important number that relates to our health. But so let's find out what's going on. In fact, 50% of the people in this country and 40% in Europe, their cholesterol numbers seem to be higher than the recommended numbers. So what's the truth behind that, right? I mean, just sounds a little weird. So let's get and understand the cool facts about cholesterol. It is found in the cell membranes. Every membrane of every cell in our body, it's made up of cholesterol. It gives that sturdity, the strength to that cell membrane, which is so important to transporting nutrients in and out of it. So that's where cholesterol is needed. It insulates the nerves, which is absolutely essential for efficient nerve conductions, the communication, right? So we need that cholesterol. Hormone production. In fact, it is essential to make these steroid hormones, including the sex hormones, cortisol, aldosterone. So we really need that cholesterol. Imagine if that cholesterol is so lowered or not present, we have such a hard time doing these things in our life. Bile production. If you guys know, bile is produced in our liver, and that's essential to be able to break down and absorb fats in our diet. Now, to produce bile, you need cholesterol. You absolutely need it. So important out there. And the final and one of the coolest thing, it's needed. It's important to create and metabolize vitamin D, especially going over these COVID times. We've seen how important vitamin D has been. You need that cholesterol to absorb and break it up and be able to use it in our body. So, these are the cool facts about cholesterol. And I hope, I've made a little attempt in changing that shift about thinking of cholesterol and related with a heart disease to thinking of cholesterol as something that's really beneficial to us. So let's have a shift here. Now, where does cholesterol come from? It doesn't come from the food all the time. A little bit of it is coming from the food, but most of it is produced in the liver. And we'll understand more of it. When you go and see your doctor and, they test you for cholesterol, it's part of the preventive, the annual visit that the doctors do. They're typically going over these 4 numbers: your total cholesterol, your HDL cholesterol, your LDL cholesterol, and your triglycerides. Now, total cholesterol is total cholesterol. HDL, LDL, and other lipid numbers included. HDL is considered as the good cholesterol, and we'll learn more. LDL, which is considered as the bad cholesterol in quotes, I'll tell you why in quotes, and triglycerides, which are nothing but the fatty molecules. Again, so we'll learn and we'll get into a little depth of that. So what is really cholesterol doing in our body besides some of the school facts? Now, the best way to understand is the analogy of a home or a house. When we have a home and a house and, we're trying to maintain it, keep it to our best level, we love it, right? So we're doing it. Now, say there is a dent in the wall. When there is a dent in the wall, what's the first thing as a homeowner you're going to do? You're going to go get some spackle and spackle it and smoothen it out nicely. Now, our bodies represent, the home, and the arteries and the other blood vessels inside represent the wall. When there is inflammation in our body, exactly the same thing happens. When there's inflammation, what happens is there's a dent that's created in our blood vessels. And when that dent is created, our body wants to protect itself, right? So what it's doing is it's telling the liver, hey, go send some cholesterol because we need to spackle it. So cholesterol is the spackle for our body. It's trying to fill in the dent and soothe the inflammation that's been causing that issue, right? So cholesterol is not the enemy, it's the inflammation. And what really we need to do to address our health and a good health here is to address the inflammation inside the body, right? So, and that's one of the things, we always tell our clients, hey, focus on the inflammation, not on just that cholesterol. Your body will produce whatever it needs to handle the inflammation. And sometimes that inflammation can go out of control when you're not doing anything to handle it. And the cholesterol will go and spackle it more and more, and that can lead to a heart disease. But it's not the cholesterol that's causing it. Cholesterol is just helping with the whole scenario there. Is what I want you to understand. Now, once we start talking about inflammation, let's understand where does inflammation come from in our bodies, right? Multiple things. First biggest factor would be and the inflammatory foods, processed sugary foods. A bigger culprit here we are seeing standard American diet, the SAD diet. It's having such a bigger impact on causing inflammation. So again, all the refined carbs, the alcohol, the sugar, the juices, the healthy organic juices, doesn't matter. It's causing inflammation. Inflammatory oils, right? So you have to go for the good oils like avocado oil, butter, or olive oil. But the other inflammatory oils like vegetable oil, corn, soy, all of those other oils, they cause inflammation in our body, and we're seeing it all the time with all the clients. Food sensitivities. Now, different people can have different kinds of food sensitivities going on, and they'll also raise inflammation in the body. But there are some common culprits also, like we're seeing gluten and dairy. They are causing inflammation in a lot of people. So again, you need to go connect with your body and see if that's an inflammatory factor in your health. Toxins, different toxins coming from the body products, the cleaning products around the house, laundry, environment, something we spray in the yard. We've spoken about glyphosates, they can all raise inflammation. Lack of vitamins, nutrients can also raise inflammation. Metabolic issues, you're diabetic, pre-diabetic, that again connects to those inflammatory foods. Again, those are the bigger causes of inflammation. Stress can be, you can never underestimate the effect of stress. Gut microbiome, that's one of the, I think, the coolest thing that's coming up, because what they're seeing is the paradigms are shifting here. They're seeing how gut microbiome can also be related with the heart disease or not having a heart disease. So really important, and I'm excited to learn and find out more on that end, right? Now, having known some of these facts about cholesterol, let's address one of the biggest myths that we come across, which is high cholesterol causes heart attacks. And we just went over that. It's the inflammation, right? Now, cholesterol is one of the factors that may influence risk of cardiovascular disease. It's not the most important one. Now look at these numbers. About 2/3 of the people that have a heart attack, they are either diabetic or pre-diabetic, mostly undiagnosed. 2/3 of the people. 50% of the people that have had a heart attack, they have normal cholesterol. So where is all this going, right? And we're constantly seeing. So you really have to look at the complete picture, right? So one of the things is your triglycerides, right? Triglycerides, they are a good indicator of telling you and your body if you're insulin resistant, and what could you do about that? Now, triglycerides are the fatty molecules, but they're not produced by eating fats. I repeat, triglycerides are not escalated or elevated by eating fats. It's usually the high glycemic index food, the refined flours and the sugars and the sweeteners and all of that. They spike up your triglycerides. So again, a really important thing there with triglycerides. LDL cholesterol. Now, LDL cholesterol, which is considered the bad cholesterol, again, It's the cholesterol that's actually moved from the liver to the site of inflammation and deposited there. That's the LDL cholesterol, but it doesn't give you a complete story here. Now, when you look deep down and do further testing, your LDL cholesterol can be made up of small particles and larger particles. The larger particles are fine. They're not gonna hurt you in terms of you getting a heart disease or something. It's the smaller particles that get into your artery, they start depositing as a plaque, and then that could cause an issue. So again, just by looking at your LDL number, do not freak out. It's important to find out what's causing it, the smaller ones or the big ones, because you really can have two different clients, one with the LDL of say 160 and other with the LDL of 100. It's possible that the client with the LDL of 100 might still have more of the smaller particles, and that is more affecting your health in a negative way than the other client who has more of the bigger particles. So again, look at the complete picture. Don't look at just that one number and conclude and instigate that fear in your heart that you're closer to a heart disease. Don't do that. One of the easy, cheap ways I tell my clients is, and I'm a little stringent on that, to check if you're affected by insulin resistance or heart disease in the future is check your triglyceride to HDL ratio. That's important. If your ratio is under 1, you're fine. Over 1, not great. Triglyceride to HDL ratio. Over 1, not great. Over 2, you're heading towards trouble. So again, that's something, because those are the two numbers that your doctors give you right away, and you can just start with that by looking at that ratio itself. There is also other ratio, which is the total cholesterol by the HDL ratio. If that's less than 4, then you're mostly on the safer side. I'm a little more stringent on that also, and that depends. But again, that's one other thing you can check just to give you a baseline idea as to where you are. Now, talking about cholesterol and from there to inflammation, what can we do to improve our cholesterol make it healthier? I usually don't like to think of cholesterol as good or bad. I just think of it as balanced or imbalanced, I think that's a better way, because cholesterol has a good aspect to it, and I don't like to associate that word to it. So now, what are the things we could do to improve our cholesterol? Number 1, getting rid of the simple carbs, like really something food that's spiking up your GI index, so refined carbs. You can go on a low carb diet, cut out juices, sugar, alcohol for sure, and you'll see a shift happening definitely in that end. You can also exercise. Of course, that's one of the biggest. If you can pack exercise in a vitamin pill, all of us should just have that vitamin pill. There's not a single person who won't benefit. So exercise, really important again for your insulin resistance and your triglycerides, impacting them in a better way. Sleep is so important again, because it helps clear the toxins and the oxidative stress. So getting a good sleep can also help. Balance the stress levels. Never underestimate the stress. Again, the same as the sleep. Start balancing your stress. You can go connect with the earth, do some bird watching, or listen to music, whatever suits you, reduce your stress. That'll totally help you to some extent. Now, one of the important factors here again is consuming more of the omega-3s. Now, since we're on the topic of omega-3s, let's understand. There are these essential fatty acids, mostly omega-3 and omega-6, that our bodies need. It cannot produce on its own. It has to be supplemented in the form of a food, right? It has to be fed to our body. So omega-3s are anti-inflammatory, which means they reduce the inflammation in our body. That's what we really want. Omega-6 are pro-inflammatory. They raise the inflammation in our body. The ideal ratio for omega-3 to omega-6 should be either 1:1 or 1:3 or 1:4 at the most. But the way we eat and live in this lifestyle, our ratio is 1:20. So there's only so much anti-inflammation, but there is so much inflammation going in our body. And that's why we're seeing elevated cholesterols in people. So again, start consuming omega-3 rich food. You can eat seafood, you can eat fatty fish, salmon, Sardines, just a 3-ounce can of sardine can give you about 2 grams of good omega-3s in a day, and see how you do with that. Your inflammation is definitely reducing. And if you're not consuming those, you can always have walnuts, chia seeds, flax seeds, hemp seeds. They are all heart healthy. So, have your good omega-3s. It's one of the nutrients I insist all my clients to have it in one form or the other every day. Really, really important. Now remember, when we were little and our parents were giving us those fish oil and cod liver oil, it's for a reason, and this is the reason here. So again, now this all connects. Again, eating fruits, vegetables, fibers is really, really important, again, to balance your cholesterol also. Now, good fats are absolutely essential. Avocados, my clients who are trying to balance their cholesterol, I always tell them, have an avocado every day. It's a good monounsaturated fat. It's going to help you. And they see a shift happening right away. So it's just so many ways to help and, handle these balancing of the cholesterol, right? Now, statin drugs, right? When somebody has a spike of cholesterol, and yes, that's territory that people go and they've been prescribed, and they do reduce the cholesterol. Totally agree on that. But again, think about the root cause. And that's what we do with nutritional therapy. Think about the root cause. Is it addressing the root cause? Because when you think about the root cause, which is inflammation, all of these diseases, diabetes, heart disease, cancer, autoimmune disease, they're all connected with inflammation. So you take a statin drug, again, to reduce the cholesterol, but what's happening to the inflammation? That's still there. It's still going to talk to your body and come out in one form or the other, right? So is that really addressing the issue? Is something I want you to think about. It's not, right? So again, get to the root cause. And again, with statin drugs, we've seen that it depletes one of the important enzymes in the body, the CoQ10, the CoQ10, which is necessary for the metabolism in every cell. It depletes that. So, just in case if you are on that drug, really important to supplement yourself with CoQ10, one of the enzymes really necessary for the metabolism. So, this is where we are with some of the facts, and there are some studies showing that when you age, when you're 70 and above, in fact, it might be better for you to have a higher cholesterol, because they are seeing better cognitive and body functions in people with higher cholesterol. So at that stage, be mindful. Don't go in that rat race to lower your cholesterol. You have to figure out what that balance is, right? Now, some of the other questions that our clients typically ask is like, hey, I have a little higher elevated cholesterol. Should I be eating my egg yolks? I should trash them, right? And we tell them, no, eat your egg yolks. I know they're high in cholesterol, but they're also rich in choline, folate, vitamin A, D, E, and K. And it's important to understand how the food cholesterol and the cholesterol that's produced in your liver are related. So go back to the basics. If you have an inflammation of, say, I'm just making it up, and if you have inflammation of, say, level 300, to handle that inflammation of level 300, your body will need about 300 level of cholesterol to handle that inflammation, right? If you're getting 200 from the food, from the egg yolks, then your body only has to produce the remaining 100 to balance that inflammation. And if you're getting none from your food, then the body will have to produce still that 300 to handle the inflammation, right? So it affects, but you also have to understand your body is just completely controlling and figuring out how to balance it. It goes down to basics. Reduce the inflammation, your body will not need to produce as much cholesterol. So yes, eat your egg yolks. You don't have to trash them unless you're eating 10 eggs in a day. Don't do that. So so that's one myth about egg yolks. Like, do we need to trash them? I would say no. Now, again, some of the things that start bothering me is, American Heart Association has a recommendation. You only eat 5% of saturated fat, right? Now, think about breast milk. Breast milk has 25% saturated fat, right? Are we going to ask a mom or someone to produce a low-fat saturated milk that only has 5% of saturated fat? No, breast milk is so powerful. It's just it builds your immunity, and we need that. So again, clear that myth around the saturated fats and cholesterol that it's all bad for you and you need to discard it. We need it in our bodies all the time. Now, I'm just we've done, worked with clients over the last 3-4 years who are struggling with cholesterol. And, there are different cases. There was a client who was completely vegan. She was not consuming any meat, any fish. And she had a spike cholesterol of 300. We worked together for 6 weeks. We just reduced the inflammatory foods from her diet, and it came down to about 220 in 6 weeks just by telling her to consume the healthy food and reduce the foods that were causing inflammation. And again, important to understand, the food can be healthy, and it can cause inflammation in one individual and it may not cause inflammation in the other individual. So it's important to identify what's inflammatory to you. So we've worked with different sets of clients who are on vegan diet, vegetarian diet, who are eating all the meats, and we meet them where they are. We figure out how to reduce their body's inflammatory loads, and then we are able to completely help them shift their cholesterol in the right direction, and also encourage them to eat those healthy cholesterol and fatty foods because they don't hurt you. It's the sugar processed food that constantly is causing and raising inflammation in our body. So foods high in cholesterol typically are, liver, egg yolks, and full fat dairy. And I wouldn't hesitate to, encourage my close ones, friends, family, clients to consume all those kinds of food. In fact, I make my own gluten-free bread. I bake it at home once a month, and, I'll top up my toast with a ton of grass-fed butter. I love it. I will not have that toast without that butter. So really encouraging you to understand the facts about cholesterol and saturated fats and inflammation. And I hope this talk will motivate you to help yourself, help your loved one in any ways. And we have a great team here with Laura and Kelly and Bree, myself, and we will be more than happy to do a discovery call for you. A free discovery call. We can talk about what's going on with you and how can we help you. So reach out to us at Home with Wellness, and don't forget to dial in tomorrow for Kelly's live. She's going to be showing you cool recipes. It's tomorrow, Wednesday at 12 noon, and also it'll be my final live session next week at 1 o'clock again on Tuesday. Thank you so much for joining in here. If you have any questions, feel free to type it out on the chat, and our team will be more than happy to answer that. But you guys have a lovely day, and hopefully the weather's clearing out. The clouds are going away, so we'll start enjoying this real feel of summer. So thank you all for spending your time dialing in, and sorry about the delay, but it was just getting disconnected. So it worked out though. Thank you so much. Bye.